Hello, hope everybody can hear me. Welcome to the launch of this partnership agreement, which outlines our ambitions across Greater Manchester about how we work together to create better homes, better neighbourhoods and better health. I'd like to introduce myself and the panel members for today and give you a bit of an outline of how the session will run and how you can take part in it. So my name is Kath Green. I'm an advisor to Greater Manchester housing providers, but I work very closely with the combined authority and our health and social care partners. We've got a fantastic lineup of panel members here today, and I hope some of you will recognise them as really key players in Greater Manchester and actually really pivotal key people in helping develop this partnership agreement. So I'm delighted to introduce you to Paul Dennett, who is the Salford City Mayor and Greater Manchester lead for housing, homelessness and infrastructure. Welcome, Paul. Secondly, I'd like to introduce you to Dr. Kath Briggs. I'm going to have to call her Dr. Kath as we go along the session, as I'm Kath too. Dr. Kath Briggs is the clinical chair of Stockport Clinical Commissioning Group, and you're very, very welcome. So pleased to have you here with us today, Kath. Thank you. And last but not least, the chair of Greater Manchester Housing Providers and chief executive of Bolton at Home, John Lord. And John has been a key player in helping get this work off the ground. So the session will be run, I'll give you a little bit of an overview of the agreement and some of our background in terms of the work that we've been doing over the last few years. We'll hear individually from each of the panel members for 5 or 6 minutes, but if somebody's on a flow, I don't really want to sort of stop them if it's a fantastic contribution. No pressure there, panel members. But equally, I also want to give people an opportunity who are on the call to engage in asking panel members questions. So if you want to ask a question, if you could please pop it in the chat side, and then I will try to get through as many questions that I can before the session closes, and I'll put the questions to the panel members I feel appropriate or who I think has maybe the best contribution to make. But also, if any other panel members want to make contributions, obviously they can give me a little hand and we can do that. But we're amongst friends here, aren't we? And let's hope, you know, just work through this new virtual world. But it's not so new, is it? Today, and actually, you know, people thinking about who've lost loved ones today as well. It's a very poignant moment, isn't it? The agreement will be made available via a link on the chat at the end of the Q&A, and obviously it won't be the last of the engagement we have on the agreement. It's really sort of the next stage in evolution and devolution of the partnership working in Greater Manchester. So, without further ado, I'll give you a little bit of an overview of what I feel about the whole sort of working arrangements we have in Greater Manchester. We have a very strong track record of working together for over many years in Greater Manchester, and this agreement builds on that. But it also builds on a memorandum of understanding that we agreed back in 2016, can you believe? And that outlined our commitments and plans and intentions for working then with the combined authority. It was very, very soon after we realised that Greater Manchester Health and Social Care Partnership were not formal partners of the MOU, and we really needed to work very, very closely with them, and we remedied that pretty soon. And we developed a whole work programme with our health and social care colleagues running alongside the MOU. But then we thought the agreement was 3-4 years old, and we wanted really to kind of restate our commitments, restate our values and our ambitions to each other. And we started to work throughout COVID, the COVID pandemic, and developing this agreement. Now, we could have just stopped, but we actually believed it was even more critical to work together in partnership to provide more resilience, enable us to continue our ambitions and actually how we deliver at scale. And the agreement we're launching today, I believe, shows that the aspirations and ambitions of the future can be far greater and far more influential and support people living and working in Greater Manchester by working together. So what are our ambitions, and how are we going to kind of work throughout this agreement, and how are we going to make it come to life? Well, we want to deliver more affordable, social and supported housing across Greater Manchester. You know, just recently we're engaging with commissioners, and you know, that hasn't happened in the past, but we're engaging with commissioners and how that kind of work needs to come to life. We want to accelerate the delivery of new homes and maximise our opportunities for delivering at scale homes made with modern methods of construction, and also contributing to our net zero carbon emissions plans. Crucially, we want to create homes for people who are homeless, rough sleep, accommodation, and support those people through kind of key difficult periods in their lives. And we've got major problems in terms of how they are trying to get back on their feet. And we'll hear some of those examples from some of our contributors. We also want to improve fire safety, building safety measures, and start to carbon retrofit our existing social homes and reduce fuel poverty, and also by doing those measures improve health of all our social rented tenants. We're also trying to make some improvements in the private rented sector through our ethical lettings agency. And why would social housing providers wanting to do that? Well, we believe we need to contribute so much to homes right across Greater Manchester, and by making more affordable and social homes available for people who are homeless, we believe we can also help drive up standards in the private rented sector too. And crucially, we want to equip our collective workforces with the right skills and training opportunities to support all residents and help in the health and well-being of Greater Manchester as we move forward. We want to work on practical solutions to address inequalities, which include anti-poverty measures, creating employment and training opportunities for everyone, but critically, our young people. So I'm going to stop there, and hopefully that has given you a bit of an outline in terms of how our ambitions will be brought to life. I'm now going to invite Paul Dennett to give us his contribution on how he sees the agreement panning out.
Okay, thank you very much, Kath, and thanks for that introduction. It's great to be here today at the launch of the Tripartite Agreement, Better Homes, Better Neighbourhoods and Better Health. And it's really good to see that relationship between housing and health being explored in terms of partnership here in Greater Manchester. And we often talk about partnership, don't we? And we talk about in Greater Manchester, we do things differently. And certainly since I've held this portfolio on the combined authority, we have genuinely done justice to the whole notion of partnership. And I just want to thank colleagues for their commitment to what has been really an ambitious agenda for Greater Manchester. And obviously today we welcome the strengthening of that collaboration in the Tripartite Agreement between the combined authority, the Health and Social Care Partnership, Greater Manchester housing providers and our housing associations that are members of the Housing Partnership, and also importantly our 10 local authorities across the city region. I think we all know that the COVID-19 pandemic has not been the great leveller that it was once referenced to be, disproportionately impacting poorer parts of the country and also areas where we have larger amounts of Black, Asian, minority ethnic communities. And that's, really challenged us to think about, well, what do we do in this space to obviously prepare ourselves post COVID-19 and be ambitious for our city region moving forward? And we often talk about it these days around building back better and fairer, in my opinion, and tackling inequalities and poverty sits at the heart of a lot of the things we're trying to achieve here through our partnership working. In addition to, as has already been mentioned, the absolute importance of truly affordable housing and the urgency to tackle what is nationally acknowledged as a housing and homelessness crisis, which, you know, in many respects is more important now than ever. And, you know, when we talk about the homelessness and housing crisis, what do we mean by that? Well, you know, some of this is complex. You have to think systemically about it. So issues such as the continuation of the £20 universal credit uplift is really important to that. The benefit cap and reform around welfare. Obviously, it was disappointing recently to see local housing allowances in the recent budget frozen for 21-22, again creating more pressures for households across the country. Concerns around the evictions ban. We know it's been extended until the 31st of May, but some of those reforms recently around significant arrears being reduced from 9 months to 6 months, and also arrears accrued during the pandemic now contributing to what legally is determined as significant arrears, are all really concerning. Colleagues will know within Greater Manchester we've lost over 95,000 homes under right to buy since 1980. 40% of those homes finding their way into the private rented sector, and many of those homes not being replaced. Again, further exacerbating this whole idea of a housing and homelessness crisis. And importantly, I think for our collaboration with housing associations, you know, concerns around the National Affordable Housing Grant regimes, which don't, in my opinion, adequately take into account the need for net zero carbon homes for the future by increasing grant rates. So there's lots to think about in that space, and how we also deal with the homes we already have in terms of meeting our climate change and carbon aspirations. Government, as colleagues will know, have recently acknowledged some of the challenges we face here in Greater Manchester with viability. And, you know, I'm thankful for the £97 million put towards the brownfield preference policy we're operating and have adopted here in the city region. But, you know, 97 million really is a drop in the ocean when we look at the chronic and historic underfunding of Greater Manchester and the North more generally. We need to go further when it comes to infrastructure funding. I also am really appreciative of the point that Kath's already made about the critical role our housing associations play in tackling the industrial and regulatory crisis post-Grenfell. Lots more work in that space, and obviously it was very disappointing last night to see that the amendment brought by McPartland was not voted in favour of by the government. And, you know, that really concerns me, because when you start to look at the Building Safety Fund and the loan arrangements now for buildings under 18 metres and fire safety works not directly related to cladding systems not being covered, there's clearly a lot more work to do in that space to support our residents and tenants here in Greater Manchester. We're ambitious. We've got a strategy for delivering 50,000 affordable homes between now and 2037. 30,000 of those we want to be socially rented or capped at local housing allowance. This agenda is critical in a post-COVID recovery sense as well, in terms of creating employment opportunities, training, apprenticeships, and obviously supporting our residents and families here in Greater Manchester. There's a direct read through as well between what we're doing here today and the good landlord scheme we're hoping to launch at the end of the month. But I think it's important to also just remind ourselves that there's a real relationship between this work and the work of Sir Michael Marmot. You know, the review 10 years on back in February 2020 highlighted that we can expect to spend more of our lives in poor. Life expectancy improvements have stalled, and they've actually declined for the poorest 10% of women. It also highlighted the health gap has grown between wealthy and deprived areas of the country. And it also highlighted the absolute importance of place in all of this. And for those of you who will remember Sir Michael Marmot's work, it prioritised giving children the best start in life, enabling all people to maximise their capabilities and have control of their lives, and also ensure healthy standards of living for all, not discriminating, creating fairer employment and good work for all, and creating and developing a healthy and sustainable approach to places and communities. And I think this tripartite agreement speaks very much to the heart of that agenda. And obviously the challenge before us all now is, how do we operationalise this? And I'll finish probably with two quick examples, if that's okay, just highlighting what we've been doing over recent years. This isn't about rhetoric. This is about actually delivering for the people of Greater Manchester. So one good example, in my opinion, will be the Greater Manchester Entrenched Rough Sleeper Social Impact Bond that was set up in 2017 to relieve and prevent rough sleeping here in Greater Manchester. It was devised off the back of a payment by results approach, working with Bridges, Trafford Housing Trust, One Manchester, delivered through what we called Greater Manchester Homes. It is actually in its final year, expected to end in December 2020, but it is in its final year now, and it targeted, as I've said, entrenched rough sleepers initially with 537 referrals, and successfully supported 324 participants into accommodation. And what's been fantastic about that initiative is 259 of those have sustained housing accommodation for over 12 months, which is a great achievement. And then secondly, Greater Manchester Housing First, a 3-year pilot funded by the Ministry of Housing, Communities and Local Government, targeted at providing safe and secure homes for more than 400 people who are homeless or at risk of homeless here in Greater Manchester, and specifically working with people facing multiple and complex needs, and those previously excluded from services or unable to be accommodated in traditional housing pathways. All programmes, as we know, have an integrated health offer in their models. And with regards to Housing First, we've worked closely with Greater Manchester Mental Health Trust, providing 4 dual diagnosis practitioners within that service. Also, mental health practitioners and social workers have been employed by Greater Manchester Mental Health Trust to support the social impact bond for 18 months. And participants have access to mental health services, drug and alcohol support services, whilst also GMMH provide leadership around safeguarding investigations as well. And then finally, in terms of some of the benefits of all of this, are the importance of a psychologically informed environment, which we've rolled out amongst people involved in all these agendas, and we've undertook significant training to raise awareness about what we mean by psychologically informed ways of working. And we've seen 450 attendances on both half-day and 2-day courses, and over 700 attendances recorded for online training since May 2020. So that really demonstrates what it means to do partnership here in Greater Manchester. So thanks for listening, and I hope that's been a quick canter through some of the great work going on here in Greater Manchester. Thanks, Kath.
Thanks ever so much, Paul. That's some fantastic points you've made there, some real food for thought. We have got some questions coming in the chat, which I will ask at the end, but please keep your questions coming so we can make the best use of the time with the experts that we have on the panel. So I'd now like to introduce to you Dr. Kath Briggs, who's going to talk to us from the health perspective about the agreement and what it can do for residents in Greater Manchester. Thank you, Kath.
Thank you very much, Kath, and thank you for the opportunity to come and speak at this really exciting meeting and at the time of this agreement. I feel really honoured, really, to be part of this and to be able to give a bit of a clinical reflection. So just starting, because a lot of people won't know who I am, I'm Kath Briggs. I'm a GP in Stockport. I still do that 3 days a week and love it from start to finish. I'm clinical chair at the CCG. But I also do some work on the Homelessness and Health Board at Greater Manchester, and I think that's how I've ended up being asked to speak here. So I wanted to give some reflections really on, I guess, my experience day-to-day in general practice. I think that's probably the most important place to start here. So just wanted to start with, I guess, why is this agreement important to me as a GP? And I'm going to start probably with some really obvious things, but I think they're really important things to capture. So we know that living in damp and poor conditions will absolutely, 100% definitely impact on people's health, whether it be chest symptoms, whether it be risks of infection, whether it be falls. There are all sorts of impacts on health from housing, and it is just so important that we think about that day to day. It doesn't really stop there, and I'm kind of thinking from what I do day to day in my surgery. You know, anxiety and depression about surroundings, about housing, about worry of loss of housing are really common problems, and things that impact me and my job every day, but more importantly, my patients. Some places that people are accommodated place people at risk because of those others that are accommodated nearby. So there are all sorts of impacts that housing can have on health. You know, whether it's physical or mental health impact. And needless to say, homelessness is another end of the spectrum really there in terms of the impact and risk of homelessness with health and the links there, but also of the risks from homelessness directly onto health. So I guess locally in Stockport, I was thinking about some of the relationship stuff. So the positive impact that I've seen when we work together as professionals. My job's certainly much easier when the links with other professionals are close, when I know that I can pick up the phone about specific cases, and when we can work across teams to improve the lives of individuals where they are, where we're not led by process, but where we're led by people's needs. And I think this tripartite agreement is moving us towards that collective working. And I guess, why is this so important now? Well, COVID has had far-reaching impacts on all of our lives, impacting most obviously in deprived populations. And as we recover as a population from COVID, I think inequalities are going to be more likely to become ever more apparent. And we need to make a conscious decision to align the work that we do to reduce the long-term impacts of this. Every day in practice, I'm consulting with people for issues which are broader than just health. I think this is something really important. So it's not just health that we see as GPs. We see how, I'm going to apologise because my dog may come into the picture in a minute. It's the joy of working from home. He's been asleep for the last half hour, but he's just woken up, which is typical. So apologies. So yeah, the impacts of housing can impact not just adults, but also children. The worry about money can have a big impact. Job security is now a bigger problem than ever, with people clinging on to work sometimes when they're not physically able to do so, just to keep money coming in to protect their families and themselves. Just as an example, I was trying to think of some clinical scenarios for those that are struggling financially. We talk about healthy eating, don't we, about how important healthy eating is to people's health. And it was just one gentleman that stuck out that I was speaking with recently, who'd been diagnosed with really high blood pressure, probably about 10 years younger than me. But I asked him about his diet and found out that, so he works 2 long distance driving jobs to be able to look after his family, has no time to think about his own food and his own diet, and was eating regular takeouts and ready meals and never having fresh cooked food. And I asked, was it feasible for him to cook a meal? And he just laughed at me, working 12 hours a day, travelling to get home, starting out at first light and back in time to fall into bed. I just didn't know where to begin for him. And as a GP, there's so much that I can't impact on. But there are many people who are working more than one job just to keep their food coming in and keep money coming in and keep food on the table for their families. Many people don't know what support there is and what they're entitled to. And even just knowing some of that, and again, linking up together to be able to share and link people to the right services and the right things that they're entitled to, might just reduce that pressure very slightly. That's sometimes enough, just to know where those funds are accessible and to know that they won't be judged for seeking that support. And for children, we need to ensure that families have safe and secure housing, and that finances enable every family to put at least one good healthy meal on the table each day. We know that healthy children are more likely to grow into healthy adults, and we know that financial and housing security are key to healthy lives. And as a system, I think we can do so much to influence the lives of our population working as a system. And when we do these when we agree to work collectively in this way, commitment to working together to improve people's living conditions and lives is just absolutely so vital to what we do. So I just wanted to reflect a little bit on the role specifically of general practice. And I guess general practice and the PCNs that we now, so primary care networks of practices, are key to making some of these changes. And obviously, if we link back to the long-term plan and some of the changes that are coming, this area is paramount. As GPs, we've got unique relationships of trust with our patients and our population. I pinch myself every day at the kind of things people share with me and just feel honoured to be in that position. We see close up a lot of the issues that people experience, and yet our remit is principally to treat disease. it's obviously broader than that. But we work in a world where there are many agencies doing many things to try and improve the lives of our population. But it's easy to see that often we can work in silos, doing our own thing and forgetting about who we're doing it for. I think the construct of the PCN recognises this importance and draws together patients and professionals at that local place level so that care can be designed according to the local and individual need. As a clinician, I've experienced multiple occasions of feeling powerless myself to effect change for individuals. However, when I can connect to the right individuals around a patient, we suddenly have the ability to transform and improve. Some of the greatest examples I've got really are around some of the homelessness work that we've done in Stockport. So I am at a practice that looks after one of our hostels. And when I think of some of the most complex patients that we've worked with, the successes that we've had in getting people into housing and supported to stay in housing have been when we've worked collectively across health, care and our local Stockport homes, also linking in the hospital or other agencies as well. And it's when we do that, when we break down the processes that we put in to make our lives easy, when we break that down, we can really have an impact on people and their lives. I just wanted to finally reflect on the homelessness and health work in Greater Manchester, which I've been so proud to continue to be a part of. In my GP role, it's easy to see how difficult it can be for people to access support. Some people experiencing homelessness don't fit with usual social norms. They can struggle with the things that we take for granted, registering with a GP, which is difficult even after removing some of the boundaries around registration. Even entering a building and sitting in a waiting room, let alone trying to explain the problems that they're facing to somebody that's seen as a professional and in a completely different realm from them sometimes. I really wanted to be a part of the work because I wanted to improve what I was doing and try and standardise care across Stockport, but also be part of being able to standardise that work across Greater Manchester so that people experiencing homelessness anywhere in GM would get the same offer. And to ensure that when people do seek help, that there's a useful outcome and an offer to them. As a team, we've developed locality leadership at every level. We've supported training as well. So for teams across the whole of Greater Manchester, we've standardised that training offer and delivered training across certain parts already, with more to do. I guess working with those other agencies across Greater Manchester has been immensely satisfying professionally for me. And I think there's a real opportunity to refresh the way we think about the wider determinants of health through this work, starting to consider some of the inclusion health work. I think I've certainly talking to Ruth Bromley, who chairs our group. I think the philosophy and the approach that we should come from is if we do it right for those on the fringes of our population, we will get it right for everybody else. Let's not leave groups as forgotten and too difficult. So we've started conversations with the Faculty for Inclusion Health, and that's a really exciting place to be at the moment. I guess in summary, this tripartite agreement provides an opportunity to draw together these key professional groups from across the system to focus on these particular populations, but also to really place housing and health together and put those priorities together to improve the health offer and to improve the whole offer and improve the health of our population. So I'll pause there and hope that's a helpful reflection, and thank you for giving me the opportunity to speak today.
Thank you very much, Dr. Kath, as you're now called. Really some fantastic insights there, as your life as a GP, as well as plugging into the system and trying to kind of influence how we can change the way we work, and you've given some brilliant examples, so thank you so much for that. So I'm going to turn now to John Lord for him to give us his reflections on the tripartite agreement, what it means to him, some of the examples that he and other housing providers have been working on across Greater Manchester. Thank you, John.
Thank you. I think it's worth saying at the start of what I'm going to say, I think, we started as a housing partnership nearly 10 years ago looking at inequalities on the back of the Poverty Commission, which was chaired by the Bishop of Manchester at the time. And 10 years on, it's still probably the number one issue that all of us are grappling with. But I do think we should recognise the amount of work that's gone on across that period of time, and we're now looking at it through a very different lens than probably we were 10 years ago in terms of the partners that we've got. And the Tripartite agreement is pretty unique in the country, if not unique in the country, in terms of the range of partners that are within it. What I was going to say is probably the things I want to reference fall into three categories. There's the obvious stuff which you'd expect housing providers to do, which is build houses, manage houses, look after the physical fabric. And there's been all sorts of work around that in terms of joint ventures like Hive Homes that's been developed with GMCA. We're now looking at carbon reduction and stepping up on tackling carbon reduction. Of course, warm homes equals good health. As Dr. Kath has just said, it's absolutely fundamental to health that good quality physical housing is good for health. It's also good for mental well-being. It's also good for a whole host of different things. So looking after the fabric of the home, making sure that people can get access to that home is really critical. On the back of Grenfell, clearly building safety is a big focus for us now going forward. We're getting some clarity as to the measures that we need to put in, and not just in high rise, which is sort of what's in the public's mind, but also in what are called complex buildings, sheltered housing schemes, supported housing schemes, places where people may struggle if there was a fire or some other incident to actually get to exits. So looking across the whole of the stock to make sure that all the buildings we've got are safe is of great importance now. We're also pushing the boat out around modern methods of construction, and we're looking at a partnership around that in Greater Manchester. So there's a lot going on around that sort of fabric of the building stuff. The other chunk of work, though, is very much about need, and both speakers have referenced sort of homelessness and other, mental health, people with mental health issues. The work that we're now doing across the three of us around supported housing is really, really welcome, because commissioning around supported housing, getting the commissioning right, getting what's built fit for purpose, suitable for the needs of the people who are going to be living in it, getting the move on accommodation and that journey through, hopefully, to independent living for people, needs all three partners to this tripartite agreement to be working really closely together, so that we don't build things that become obsolete in 5 years' time, but actually continue to be flexible and meet the needs of everybody. And that's a big focus of work, I think, for all of us. And the growing partnership with the Greater Manchester Mental Health Trust is also absolutely fundamental to that, because I think that we all acknowledge that there was a mental health crisis before COVID, but that's probably nothing compared to what we're likely to see in the next 12 months going forward. And again, we all have a part to play in that. And we are finding as housing providers that our staff increasingly are providing support around mental health alongside health colleagues and local authority colleagues to prop up people in the community. So there's a number of things around that needs, the housing access, looking at who accesses our properties, making sure properties go to the people in the most need. The homeless schemes that Paul spoke about, meeting most acute need and actually tackling destitution in many cases. Not just around homeless people, but destitution in our communities and neighbourhoods as people lose their jobs. Things like supporting food cooperatives, food banks, the provision of basic needs, which I don't think any of us really foresaw when we came into housing. In my case, over 30 years ago, providing food to our tenants certainly wasn't something on the Chartered Institute of Housing course that I did at that particular time. So there is that just basic meeting needs. And the third chunk is very much about communities and neighbourhoods. And I think during the last 12 months, housing associations in Greater Manchester and the 28 in the partnership, who are all rooted very much in place, very much rooted in with the local authorities in Greater Manchester and working in partnership with the voluntary sector, supporting health colleagues, working, as I say, with the local authorities, have really found our our niche in terms of what we can bring to that debate around community and neighbourhood and place, and joining up the individual needs of the tenants and the residents in the areas where we've got properties, and making that join to the services that they may require at times of real acute problems in their lives. And we've all played a massive part in that community sort of effort really during the last 12 months. But even before that, the Greater Manchester Housing Partnership was looking particularly, as I said, at inequalities, which is still there, still very, very present, and in some ways more complex than it was before. And that is probably the number one priority when it comes to communities and neighbourhoods. How do we actually get people into work? How do we get people so they've got equal access to things, that they've got an equal say on what goes on in their neighbourhood and community? You know, the list is endless, but that's what makes resilient communities. You know, unequal communities are not resilient communities. And so that effort, I think, that underpins the tripartite agreement is how we actually make Greater Manchester more resilient, more able to grow going forward, but growing for everybody and not just certain groups of the population. And I think that underpins the work, and it also underpins the tripartite agreement. So I'm happy to stop there and hand over to questions and hand back to you, Kath. But I'm just very pleased that we've even got to this point where we've got that range of partners signing up to it.
Thanks ever so much, John. Thank you for all the contributions. John, if you can put yourself on mute, that'd be great. Before I open it up to questions, I just wanted to reflect on some of what I've heard in the last few moments and the presentations that have been given. I mean, the first one is tremendous understanding of the complexity of needs that exists across Greater Manchester. You know, if we understand what the problems and difficulties are, as well as what the opportunities are, then I think we stand a good chance of breaking down some of the barriers that we know some of our residents face every single day. I think there's also been an acceptance among the partners is that let's talk about the barriers that face us in terms of trying to move further faster. And if we understand what the barriers are stopping us, each of us doing those things, it's got to be within our own gift to reduce those barriers or eliminate those barriers as far as we can. And I think the dialogue over the last few years has certainly helped partners understand that more. And there's a real openness amongst colleagues in each of the three sectors, housing, health and the combined authority, which obviously includes the 10 districts as well, to really understand how collectively, you know, we can work together. So the passion that I've heard from our three speakers and the real examples that each of them have given says to me that we do stand a chance of making a difference. And we have made a difference in some areas, as you know, Paul outlined in terms of the SIB, the outcomes of the SIB, and how we are ambitious to do more on the Housing First agenda. And the examples that Dr. Kath gave around people who attend her virtual surgery every single day, talking to her about some of the problems, which actually does give doctors a real rich evidence base, if you like, about how you could see the system being more connected and how, you know, relationships like this help people, your patients coming through the door or virtual door every day. And then John talked there about the expertise and why housing providers got together in the first place and was to tackle inequalities. And you know, we're not just landlords, it is about tackling inequalities. And there's been lots of publications around the work that all three partners have done on websites. So I would definitely direct you to the three partners' websites to look at some of that. We don't have the time to go through all of those today. Now, I have got a number of questions in the chat, so I'm going to sort of take some of those questions now, and as I'll pose them to each panel member. I think I've deleted one by accident. I've got a new Surface PC and I think I pressed delete instead of just scrolling up. So if I don't ask you a question, it's my fault, I'm sorry. So you might want to put it back on again. So I am going to start first of all, for the first question we had really early on in the session, so I think it really deserves a hearing, which is from Niall Griffiths from the Manchester Evening News, and it's for you, Paul, particularly, and Dr. Briggs, Kath, I want you to comment on this as well. So the first bit of the question is that, Paul, you said that the partnership will complement the Good Landlord scheme due for discussion by the GMCA this Friday. Could you explain the impact that the pandemic has having on the financial and physical mental well-being of tenants and landlords in the private rented sector, and how exactly this scheme is going to help them going forward? And just while you ponder on that for a moment, Dr. Kath, the kind of second add-on bit of that is, what would you like to comment on the question above around the health impact on tenants and landlords? So just to give you both a little time to think about that. So Paul, if you'd like to maybe go first. If you want me to repeat it, I will, but hopefully you've got the gist of it.
No, thanks very much, Kath, and what a great question to start with. I think it's fair to say COVID-19 has massively impacted all of our lives, both our physical and mental health, and for some of us, our financial well-being as well. And for anyone who's read the papers published for the Combined Authority, you'll know that at the moment in Greater Manchester, we have 105,000 households in the private rented sector claiming housing benefit or the housing element of universal credit. That data's from November of last year, so I expect that to have probably increased. And just looking at that data alone, that's increased by 30,000 households since January of last year. So undoubtedly, there has been a huge impact on people living in the private rented sector as a consequence of COVID, and then what's obviously played out economically. And we know that that's been exacerbated by, businesses being excluded from support, people being unable to access self-isolation support. But how does the tripartite agreement hang together with the Good Landlord scheme? Well, if you've read the papers for the CA, you'll note that at the heart of our Good Landlord scheme is providing up-to-date information, advice and guidance. And I think Dr. Briggs did reference that. Colleagues will know housing and welfare rights and non-statutory services in local government, and they've been massively impacted after the last 10 years of austerity and local government cuts. So, supporting and enhancing that provision, working with our partners such as the Citizens Advice Bureau, is very much part and parcel of what this is about. And it's about us all having a single understanding of what's available so we can all actually play a role there in signposting and supporting each other. But importantly, at the heart of the Good Landlord scheme, there's so many schemes and charters, aren't there? At the heart of it is strengthening enforcement capacity. Again, massively impacted over the last 10 years with austerity and cuts, where regulatory services have been hugely impacted in councils across Greater Manchester. But working with the Fire and Rescue Service, GMP, trading standards, we're looking to invest £1.5 million over the next 3 years to really enhance and support that regulatory and enforcement capacity in the 10 districts. Works out at £500,000 a year, and we think probably 75% of the overall allocation will be going on enforcement activity. Some of it's also about capacity for landlords and agents as well, better supporting tenants, training and access, and signposting to things like, retrofitting grants that are available nationally for landlords operating in the private rented sector. But I think it's important to stress it's about being serious around enforcement, and that's about civil penalties of up to £30,000 per offence, prosecutions, rent repayment orders, banning orders, and if we need to, using our compulsory purchase powers both at a district level and at a Greater Manchester level. And then finally, I think if you look at the document that's going on Friday, the importance of working with ethical and social investors is it very much at the heart of that. The Ethical Lettings Agency is part of that, and obviously Resonance and some of the initiatives we've announced more recently sit at the heart of that. And that's to complement the enforcement activity, offering landlords within Greater Manchester an exit route should they choose to utilise that. And then finally, it is about lobbying government for positive change. That sits at the heart of a lot of the strategic work I've certainly been overseeing. We still don't have a renters reform bill. You know, government promised that they're going to abolish Section 21, the no-fault evictions. That still hasn't happened. We want a conversion acquisition fund to acquire properties and convert them into affordable housing, as recommended by the Affordable Homes Commission. Welfare reform is part of this in terms of getting the local housing allowance back to the 50th percentile of local markets like it used to be, I think, back in 2011. Maintaining that £20 uplift on universal credit and increasing discretionary housing support as well. It sits at the heart of this. So, yeah, hopefully that's a full answer. Thanks for the question, though, Niall. Really appreciate it.
Thank you, Paul. Dr. Kath, I don't know whether there's anything you want to add specifically around the point that Niall's made around health impact on tenants and landlords.
Thank you, Kath. Yeah. I mean, I guess, you know, we all have had our own COVID experiences, haven't we, and COVID impacts. And I think we'll all have felt it in different ways. You know, and I guess, again, just thinking about day to day, the kind of impacts I'm seeing for those that have had COVID and are suffering long COVID and struggling to get back to work because of that. Those that have gained the COVID stone, you know, those that have become more isolated, those that have become more depressed and anxious as a result. This is something that I think we were all worried about, and we're now seeing it come through in reality. I think in terms of, so what does this agreement do for that? I think it brings people together to think about, as I said before, to think about people, to think about individuals. I think if we do it right, we can try and think about how we break down some of those processes and knit people together much more closely around individuals and around place. So I guess they're my main reflections. You know, specifically about landlords, I'm not sure, but specifically about people and some of those are tenants. I think, you know, we've all been impacted, and just at different levels. And for those that have leased, they'll have been impacted more. And it really is the opportunity now to do something vastly different.
Thank you very much. I'm going to go to the next question now. It's from Jack Gould from the Greater Manchester Health and Social Care Partnership, and the question is directed specifically to Dr. Kath and John Lord. I'm going to go to John first to give Kath a little bit of a break. But the question is around mental health, and it says, how can we improve data sharing between social housing frontline workers and local health and social care colleagues? For example, community health teams. Often housing officers are the first to note the early signs of a crisis for their tenants. There are also opportunities with social prescribing link workers, providing a bridge between social housing teams and primary care networks. This is crucial, particularly for older residents who are at the risk of isolation and loneliness. So I read it all out verbatim, but so people can hear it. But I think the question is really around how can we improve data sharing between those colleagues who are frontline to, you know, support that mental health, isolation and loneliness. John, I'm going to come to you first.
Okay. I would slightly change the frame of the question from a housing provider point of view, because actually the group of our staff who see things the most are actually our repair operatives. It's the plumbers, the joiners, the gas fitters. They're the people who go into people's houses on 80% of the transactions we as housing providers have with our tenants. So actually there's an internal training issue, not necessarily so that they become sort of trained mental health experts, but at least enough to be able to signpost to people who are, because otherwise we miss an awful lot of people. Most of our tenants, the only member of staff they'll see will very often be the person doing the repair, not necessarily a housing officer. There is all sorts of stuff happening already around joint training, around housing officers. A lot of organisations are doing at least that sort of mental health awareness training for the repair staff, so that, like I say, they've got the ability to signpost. Increasingly, the number of people that we're now working with are people with mental health problems. Very often have fallen through the sort of thresholds of getting services and being eligible for services, but are still living with their mental health problems on a day-to-day basis. So it is a massive priority for, I think, all housing providers to actually make sure that your staff have at least got good awareness, good training in terms of signposting where people need that specialist and targeted help, and also good relationships. These things tend to work on relationships. If you know who you're picking the phone up to, what you need to say, how you need to support people, and you've got those relationships in place, that's absolutely, in some ways, more critical than agreements and protocols and things like that. And I think a lot of housing providers with health colleagues and local authority are now sort of developing those stronger relationships, because it is just something that's so prevalent in all the work that housing officers and other people are now doing. But it needs to go further, and it does need to have those sorts of information sharing agreements in, so that you can actually share data, so that you can actually share information where it's to the benefit of the person to be able to actually get the treatment and the support that they need in order to get on with their lives.
Thanks, John. Dr. Kath, do you want to say anything about that?
Yeah, first of all, to say I'd never thought about it as John's just described, that it's the plumbers and the technicians that are going into houses that get that first-hand view. And I guess it's challenged me a little bit that they're people that I don't speak to. And it made me think about, well, at what point do I hear from people? Because I assume that goes through social workers and somehow comes to me. But in our new world with PCNs, there is a huge opportunity here to start to join this together much better. Anybody that's seeing something that they have a concern about needs to be able to share that. And I think you're right, John, picking up the phone, knowing that there's somebody that you can speak to about that is really, really important. And knowing that there's a channel that gets to the right place, or that seats people around the same table, whether it be multidisciplinary team meetings, whether it be whatever, that there's got to be that place where people can meet and have those conversations. Alongside that, though, we need to sort the digital to support that working. Obviously, we need to be bound by confidentiality. Obviously, we need to protect patients and people through this. But equally, we need to be sensible about, working to the benefit of individuals, asking permission to share information where necessary. But definitely, I think the PCN and place is the place that we can do this better than any other. So thank you.
Thank you. I'm going to try to motor on with a few questions. We've got 7 minutes left, but somebody's asked a question if we can provide answers for those questions that don't get asked, and I'm willing to do that, but I don't know how we would get that information out. So leave that with me, and I'll speak to the team later in terms of how we might be able to do that. So quickly on to the next question. It's from Bob Green from the LGBT Foundation, and he asks, how will you measure the success of the agreement for all communities? For example, LGBT people have particular health and housing issues, but they may not be included in impact assessments for health and health strategies. Will community groups be involved to share their experience and suggested solutions? John, I'm going to come to you first on that, and then I'm going to go to Paul.
Thanks, Kath. And it's quite timely, because I think Bob's coming to the Greater Manchester Housing Partnership on Thursday to actually speak to us about this, or at least part of this topic. I think from a housing provider point of view, there's quite a lot of work to do, if we're being honest, around this. We did a diversity survey of all the housing providers only recently, and that was quite good at pulling out the gaps where a lot of us had, we're probably sitting there thinking, yeah, we're fantastic, of course we're fantastic. And then when you see the surveys, you see where the gaps are. And I think there's we've got a group led by Sasha Deepwell at Irwell Valley, who are really looking at how do we make sure that we, as I said, I suppose at the beginning, how do we bring the community together or move forward together, making sure that we are meeting the needs of all sorts of different groups. That's a big piece of work, but it's one that we've identified as a priority. And like I say, Sasha and the diversity and equality group that we've got is have really got to focus on that. But at least we know where we're starting from as housing providers. And I always feel that even if you're starting from something that's got gaps, you're always better knowing where those gaps are so you can actually start to work on that. But are we there yet? No, we're not. But we've certainly got things in place to try and move to make sure that we don't leave people behind in terms of what we provide in the future.
Thanks, John. Paul, do you want to add anything?
Yeah, no, thanks, Kath. And this is a really good question. And obviously, a lot of the work that Councillor Warrington is leading on at the moment in terms of tackling inequalities and a whole range of different things that sit within a portfolio have a read across all of the work across Greater Manchester and the work of the Combined Authority. And I certainly know I've already been asked to share with her my views and thoughts on my portfolio and area of responsibility within the Combined Authority. So for me, some of this is about working with other leaders in Greater Manchester who have responsibility for this agenda and making sure that there is a coordinated approach across all the portfolios of Greater Manchester around how we actively respond to the Equality Act and obviously the protected characteristics within the legislation. But I think importantly, you know, tackling inequalities for me is very much at the heart of this agenda. I mean, we've talked about how you can't look at housing in isolation. You have to think of it systemically. There's read-throughs into welfare reform. There's read-throughs into what's happening in the labour market. There's read-throughs into the housing market itself. And obviously we are facing a housing and homelessness crisis. So in and of itself, for me, there is a real inequalities issue that sits at the heart of how we approach housing within the United Kingdom. And for me, it's about tackling that inequality, tackling that poverty, but doing it in a collegiate way and being very much motivated by delivery and outcomes rather than strategy, policy and rhetoric. Although I understand there's a space for that, it's about delivering for people in Greater Manchester. People are seriously suffering at the moment within Greater Manchester, and it's incumbent upon all of us to actually, you know, put our hands to the wheel in driving solutions that genuinely put people at the heart of this and put tackling inequality and poverty at the heart of what we're trying to achieve here, which I do think we are trying to do with this document. I think it will need to obviously roll it out into organisational delivery plans, local authority performance monitoring. All of that needs to be part of it. And obviously local authorities have the public sector equalities duty. So when they are taking decisions, they should be considering equalities impact part and parcel of the decisions that they take. So thanks very much, Kath.
No, thank you very much. I'm going to just ask one quick question to John to finish because we've only got a couple of minutes left. And it's from Charlie Norman from Moscow St Vincent's, and she's asking, how do we use our unique partnership to ensure that our decisions and actions now contribute to a positive, healthy future for this and future generations, thinking long term in a short term world. So John, if you could be really brief with your answer, I'd be really grateful.
I think what we've got to do, we're in a very different position than we thought we would be in. So let's face it, 18 months ago, you know, what we thought were our action plans 18 months ago across all agencies, we pretty much ripped up. And I think there's a number of things that run through the work that we need to do. I think one is we've got to give people hope. I think people are absolutely desperate for some hope, whether that's around employment, housing prospects for the children, prospects for the community they live in, prospects for the health, you know, because a lot of people's health needs have had to go on to sort of almost hold while we've been dealing with the pandemic, you know, and those sorts of concerns are going to come through. I think we've talked about mental health. So I think one of the things is to give people realistic hope, not just blind optimism, and underpinning that is making sure we deliver. I remember that the launch of the care leavers pledges that was during the pandemic, which was one of the early achievements of the three-way partnership that we've got here. It's not the pledges that matter, it's the delivery and making sure that we actually, you know, deliver on the words is something that hasn't always happened in the past, if we're all really honest. And I think, you know, making sure that we've got things that bring the community into that delivery so that it brings people with us and it's not things being done to people, is what will actually make those long-term goals more of a reality.
Thank you, John. Paul, Dr. Kath and John, I'm so happy that you've joined us today at the launch of this event. I hope people listening in and asking the questions have actually got a bit more of an insight into the document itself and what we're trying to achieve. As I say, the link will be put on the chat at the end. So I really do thank you very much, and all partners are really committed to delivering and making a difference. And as Paul Dennett said, it's not about the rhetoric, it's about what we do, and that's how we do it differently in Greater Manchester. So thank you for joining us all today, and please keep your questions coming after the launch. In terms of the document itself, you can see who we are. We're fairly visible on LinkedIn, Twitter. Ask us questions, we'll do our best to answer them. Thank you, everybody. Bye.
Thank you.
Okay.